So we're continuing with the load deformation curve, or sometimes known as the stress strain curve, and let's add some more terminology to it. One of the funny terms I think in this chapter is the word creep. So what is creep? It's going to apply to our tissues, and especially the elastic components to tissues. Creep is sometimes also referred to as hysteresis. So that's another term that you're going to want to know. Creep or hysteresis. Hysteresis. So hysteresis is for creep as another term for that. And if I were to describe creep, I'm going to get a picture here, and I think this will kind of make more sense with creep. Alright, so here we go. So this is a picture of silly putty. So I'm sure as a child, or maybe just the other day, all of us were playing with silly putty. And you get it out of that little red egg-shaped container that it comes in, and you pull it from end to end. And what you typically notice is that, that fresh silly putty, it's almost like a oily feel to it. And you pull on it, and then if this guy were to release it, it would stay in that lengthened position. So this is a very clear elastic plus a plastic change. Now, if we were to refer to this as tissue, this would be within that micro failure range, not the ultimate failure point, but it would be in that lighter blue plastic region there. So that is an example of creep or hysteresis. If you pull on tissue and it would stay lengthened. With silly putty, this happens very quickly. Within our bodies, though, if you were to lengthen a muscle for a few seconds and then to let go, you can imagine it's not going to stay. So if I have tight hamstrings and I stretch the hamstrings up for 5 seconds and then I let go, the hamstrings are going to return back to the normal length. So we don't actually cross over into that plastic region. We just stay there. So that can happen with creep. Now the other thing, what is the stress difference between fast or slow loading? So I'm going to get another picture of this. So I have a different picture of some silly putty. Now you can imagine even this silly putty, it looks like it may have been sitting out for a while. It's kind of dried up, so just like with our normal aging process, it's lost hydration, it's lost water. Just like as we get older, we lose gags and proteoglycans and other things like that, proteins within the tissue. But even if it wasn't sitting out, if you were to take tissue and you were to load it very fast, so if you were to pull that taffy apart or that silly putty apart really quickly at a really high acceleration, that's going to increase the force that's being applied there. And so let's look at that on this next slide. So with this is showing you elongation, and it's also relating it to tissue stiffness. Now on this picture here, you can see there's a smaller thickness, or we would refer to this as a cross-sectional area, or CSA. So there's a smaller CSA, and then there's 2 times the CSA. Since there's more thickness or a higher CSA, it's going to cause more force needed to get the same elongation. So in this case, if I want to get, it doesn't really label this, so 1, 2, 3, 4. If I want to get 4 millimeters of elongation, and I have this cross-sectional area, I have to apply 50 newtons of force. I'm just making that number up. So 50. But if I want to take this tissue and I want to get 4 millimeters of elongation, I have to apply 100 units of force. So that is one way. We could add more fibers to make the tissue stronger. How do we add more fibers? That gets down to the stress strain curve or load elongation curve, and that we have to take the area to the plastic region repetitively over time. This is not going to happen within a session, but if the tissue is loaded again and again and again over time, and there's breakdown and regrowth, over time, over several months, the tissue may gain increased fibers, and it may gain cross-sectional area. So that's the idea with hypertrophy or increased bone density activities. Depending on the tissues that we're talking about within the body, they can take a long time to regrow tissues. And obviously, the younger and healthier you are, the easier it is to make these changes. So there's a lot of comorbidities and other factors that go into this. So that's going to increase strength by adding increased cross-sectional area. Now the other thing, and this is in both of these, is that stiffness amount or increasing tissue length means that it can elongate further under the same loading conditions. So we're saying it's decreased in the amount of stiffness. Stiffness is reflected by the slope of the linear portion of the curves. So if that doesn't make sense to you, well, slope of the linear portion of the curves. So in this, it's more, I'll just put this in other terms, it's more like a uphill, and this is more of a gradual ramp. So if it's more gradual, there's less stiffness. If it's more vertical, there's more stiffness. And the stiffness is going to be related to how long it can elongate. So with this, maybe you could go back to the silly putty example. If I have that fresh new silly putty, there's going to be really low stiffness. It's kind of going to be like this. Basically, if I were to draw that out, it'd be like that. But let's say I leave the silly putty out a day. It's going to be kind of like this. Now, what if I leave the silly putty out for a month on the countertop and I go to it? It's going to have a lot of stiffness. And this gets back to the idea of why do we encourage our patients to warm up? Why do we encourage walking or biking or some type of calisthenic or aerobic activity in the beginning? And that's because those activities bring increased blood flow to the area, and that brings an actual tissue temperature rise to the area, and stiffness is decreased. So maybe you're watching a football game last year and you're watching the running back, and on the sidelines, the defense is on the field, but the running back's on this bicycle on the sidelines. And what he's trying to do is he's trying to prevent stiffness from setting in. He's trying to keep the muscles warm. Or maybe you're watching a baseball game and the pitcher, you see him put half his jacket on over his shoulder between innings, or has it wrapped a little bit. They want to keep the arm warm, so to speak. They're trying to decrease the stiffness, because if there's too much stiffness and the player goes to elongate it, they know that it's more likely to get to that failure point. So these are the basic principles applied to this, but they have a lot of implications throughout our daily lives. So here's some examples and other terminology. So this is your static unloaded tissue. What happens if you apply stress at each end? So you pull the silly putty or the string on each end, or you're throwing a baseball, that you're pulling the humerus away from the scapula. So you're pulling on the rotator cuff musculature there on each end. So this is measured in newtons, big newtons. I was just kidding there. So it's measured in newtons of force. That's the application there, and it does matter how rapidly or the rate at which this strain is applied, because we know if there's a higher acceleration, force equals mass times acceleration. So even with the same mass, so the ball or the bat may have the same mass, but if you're swinging the bat or throwing the ball at a higher rate, it's going to increase the tensile strain on the tissue, which is going to increase tensile stress. Versus, what about compressive strain? So this would be, let's say I jump off of a 4-foot wall and I land onto both feet. There's going to be a large compressive strain on the cartilage within my spine, within my knees, within other areas. But let's say this is the knee meniscus. There's that compressive stress. My femur is pushing into my tibia, and my meniscus is right in the middle there. So that is a compressive strain. It's still a strain. And even though we're dealing with cartilage, and we don't think of cartilage as a tissue that can be strained, you wouldn't say you have a meniscal strain necessarily. From a physics standpoint, the tissue's under strain. So I do want to clarify that tendons and ligaments can both be strained. They can both receive compressive strains and tensile strains. They're more likely to be injured with tensile strains. from a pathology standpoint, we name them sprains or strains. But from a physics standpoint, the forces applied are called strains. They're not called sprains. So if you're dealing with the biomechanical forces, strain is the correct word to use for all tissue types. Oh, how is this measured? So this is measured in pascals. All right, pascals or pascals, however you want to pronounce that. That's how that's measured. All right, so let's apply this to more of a clinical scenario. And on this slide, for some reason, part of this image is arranged differently, but on your handout, it probably looks a little bit better. So with this scenario, we're going to call this a genu valgum deformity, in which the femur is adducted, and then the tibia is actually more externally positioned here. So you have this deformity genu valgum. Sometimes we refer to this as knock knees, or where the knees are caving in. And so with this, you're going to see at the knee, there's two compartments of the knee we're going to talk about: the medial compartment and the lateral compartment, and they're receiving both different stresses. So the medial compartment, you have your MCL, medial collateral ligament, and your medial meniscus. On that side, it's actually going through a lengthening. It's receiving a tensile stress. What about the lateral aspect, the LCL, the lateral collateral ligament, and the lateral meniscus? And there are other structures involved, but I just want to give you only several structures. They're going through a compressive strain. So if someone were to walk or run repeatedly like this, you might be able to guess or estimate which structures would be compressively loaded and cause damage there, and which structures will be tensile loaded. So this repetitive running may cause a sprain of the MCL, whereas it's unlikely to cause a sprain of the LCL. And also, you can see it's likely to cause increased compressive load and increased deformation of the lateral portion of the meniscus as opposed to the medial portion. So that's an example of material properties. And what if we go to the SAID principle? What does this stand for? And this is the example of from the Avengers. So what if you're like Thor, and after the last one, you're just gonna take some time off, and you're just gonna play video games and do other things. So you're gonna change. You're gonna have changes to your biological tissues. You're gonna have decreased bone density, decreased size of the muscle. You're going to lose sarcomeres in series. You're going to have decreased tendon density, all these things. So it's a specific adaptation to imposed demands. So some people say if you don't move it, you lose it. But that's just kind of a layman's terms of this principle. It's very similar to Wolff's Law, although Wolff's Law is related specifically to bone tissue. SAID principle applies to multiple things. It could even apply to their nervous system tissue. Specific adaptation to imposed demand. So if I always bat or throw right-handed, I'm going to have a propensity to be able to do those in a coordinated manner. But let's say I stop throwing right-handed and I only throw left-handed, or bat left-handed, or only eat with my left hand. I'm actually going to lose the ability and the coordination to do things on my right, and I'm going to gain the ability to do things on my left. But what do you think about the answer for this one? Immobilization could cause changes within blank weeks, but recovery may take 18 months or longer. So for this, it's going to vary on the tissue in the individual, but within a few weeks. The textbook also says that ligaments and tendons show a 50% decrease in tensile strength and stiffness after 8 weeks of immobilization. So after 8 weeks, you can have a 50% loss of strength. So that's why wellness and continued activities are very important. Right, so there you go. So what do you think? After how many weeks? Yes, after 8 weeks, ligaments can show a 50% reduction in strength. I do want to just clarify once again, typically with ligaments, when we're talking physical therapy, we don't refer to ligaments as having strength because ligaments are non-contractile. But the term strength, stress, strain, and so forth, those are physics terms that we apply to materials, and they are really applicable to ligaments. So ligaments do have tensile strength, even though they are not strength generating when we talk about force production or contraction. And then the last slide I'll leave you with, which is a nice summary slide of the different tissues and what happens with decreased load versus increased load. We talked previously about cross-sectional area or CSA, but there are all these other things as well that go along with that. And these are important things to mention. You'll see PG on there, and that's proteoglycan, or other things on here, fewer proteoglycan aggregates. Now, GAGs aren't mentioned on here. Remember, GAGs are the extension of these proteoglycans that help their formation as well. So ultimately here, with decreased load, you're going to lose proteoglycans and GAGs. With increased load, you're going to get more fibroblastic activity to produce more collagen within bone. You're going to get more osteoblastic activity, and so forth. So with this, there is just a mistake up here. I don't know why it decreases there. So this should just be denser bone. So let me just eliminate that. So that's the chart. So that's a good thing to know, and that is on page 74 of your textbook.